morning, ladies and gentlemen. This is Dr. Paul. Thank you very much. I want to talk today about Isotretinoin, that is 13-cis-retinoic acid, that is useful in the treatment of severe acne vulgaris. So that is acne, that is it reduces sebum secretion, and for up to 1 year after the cessation of therapy, it decreases the relapses of acne. So this drug is very useful because it decreases the sebum production, and it also has anti-inflammatory properties. Due to its anti-inflammatory properties, it decreases the comedogenesis in these patients. Now, the primary indications for therapy with oral isotretinoin. What are the basic indications? First of all, severe nodulocystic acne. Acne that improves less than 50% after 6 months of treatment with oral antibiotics. You used so many antibiotics but it didn't work. Those people need it. The relapsing acne. And sometimes patients get these scarring all over the face. Those patients need it. And sometimes it becomes fulminance, very severe, and patient has a psychologically depressed. Those patients need Accutane. Now, over 80% of patients experience a long-term stable remission after one course of therapy. So 80% of patients get benefit from this medication just after one course. And you can actually give like a few more weeks, like 8 weeks or 2-3 months, and then you can retreat these patients if you do not see any improvements. Now, this medication is a costly medication, but you see, this is the only medication, that is isotretinoin, is the only medication that changes the natural course of acne. That is so it is worthwhile to use this medication. Now, the most important thing to remember is the teratogenic potential of isotretinoin. That's a very important point. In the United States, we have FDA, Food and Drug Administrations. It formally controls the administration of isotretinoin. So always remember that. In fact, most physicians do not even touch this because of all the regulations that are associated with. So let me talk about isotretinoin safety for a few minutes. Isotretinoin is associated with a number of adverse effects, and that's why it has limited use. On the top of the list is teratogenicity. It is teratogenic. It can cause spontaneous abortions, and it can also cause life-threatening congenital malformations. So embryopathy may result. Patients will develop craniofacial abnormalities, thymus abnormalities, cardiac abnormalities, and central nervous system malformations. All these things can happen when patients get embryopathy out of this use. So you need to carefully follow every female patient who comes and asks or for whom you are going to prescribe this medication. FDA requires the many following things. Number one, all female patients who can become pregnant, they must have at least 2 pregnancy tests, whether urine or blood. You should do 2 pregnancy tests. Make sure they are negative, and then you should start this medication. And each month you should do a pregnancy test. And all of these results should be stored in the electronic FDA system. That's very important. And also, all female patients who can become pregnant, they should use 2 birth controls. If they can't use birth controls, they should abstain from sex for at least a month before starting the therapy, during the therapy, and after the therapy. So that those two things are very, very important. Pregnancy tests before starting the patient on this medication, and abstinence from the sex or using at least 2 birth controls. Now, physicians, not every physician is eligible to prescribe this medication. Only physicians who know the treatment of acne, who know this medication and its adverse effects, are registered under this Isotretinoin Accutane registration, and only they are eligible to prescribe this medication. So always remember these most important points, because those are the points you will be tested in this examination. Now a few words about side effects. Accutane causes many side effects, like the skin, like cheilitis and dry skin, and sometimes skin desquamation. Some of the patients develop photosensitivity and itching all over the body, the pruritus. And these are the side effects that bother many, many patients. Some patients complain of arthralgias, the joint pains, myalgias, the muscle pains, and hyperostosis and pseudotumor cerebri. That's an important point. Some patients develop vision problems, corneal opacities, hepatotoxicity. Some patients develop bone marrow suppression, hypervitaminosis A. So pseudotumor cerebri can happen. Some patients develop hypertriglyceridemia. The triglyceride shoots up like 800 milligrams per deciliters in some patients. Some patients actually even develop depression. Actually, there are concerns that people on isotretinoin develop depression and suicide, but there are no studies that have shown any considerable evidence that there is a tendency that patients who receive isotretinoin develop depression and suicide. So those are the most important points when we talk about the side effects. But you see, you don't have to stop the medication because the patient has these side effects. You can actually use the other medications. Like, for example, if the patient complains of dry skin, you can give emollients. The patient has some kinds of, especially in the beginning of the treatment, they develop, actually it aggravates the problem. In those patients you can use corticosteroids and non-steroidal anti-inflammatory drugs when the patient develop muscle pains or joint pains. So also you can change the diet, or you can treat the hypertriglyceridemia up to one point when the lipid abnormalities happen in these patients. So if the patient develop these side effects, don't just stop the medication, but follow them. You should always follow liver function tests, CBC, and lipid levels at regular intervals, because as I said, isotretinoin, it suppresses the bone marrow, so you need to follow CBC from time to time, and they affect liver function tests, so you need to do liver function test to monitor for any signs of hepatotoxicity. And you should always do lipid panel to say hypertriglyceridemia, because hypertriglyceridemia, when it becomes very, very high, can cause pancreatitis.